Let's learn about the Norma Verticalis of the skull. What is Norma Verticalis? When we see the skull from above, we refer this view as Norma Verticalis. Now, what are the bones that we can identify here? This is the frontal bone. These are the two parietal bones. The bones are separated by, this is the coronal suture. This is the sagittal suture, separating the two parietal bones. Occasionally, we can identify one more suture separating the two frontal bones. If this suture persists, we refer it to as metopic suture, where we have the meeting point of the coronal suture and the sagittal suture. This region is referred to as the bregma. In neonates, this area or this landmark corresponds to the anterior fontanelle, which is an unossified diamond-shaped gap which closes at about 1.5 years. Apart from this, what are the other features we can identify? Now let's try to turn the bone and look at it from the posterior aspect. So let's see the bone now from the posterior aspect. So what we have here is we can identify the lambdoid suture. Along with that, we can identify this opening. What is this opening? This is the parietal foramen. It can be present on both sides or it can be present on one side. Occasionally, this is also referred to as the third eye. Then, these two areas are called as the parietal tubers or parietal eminence. Deep to this lies the posterior ramus of the lateral sulcus of the brain and also the vernix sensory speech area. Lambda can be best seen from Norma occipitalis, and we will learn about that in Norma occipitalis. These are some of the major features we need to identify in the Norma verticalis.